Okay. Hello, everyone. I want to greet you from Washington, D.C. It's morning here, but I'm sure that you're having a great time in Istanbul in Ravi Medrese. I wish I can be with you there. Today, I want to introduce myself first. My name is Zeliha Koçak Tufan. I'm an infectious disease and clinical microbiology specialist. I was working in the Ankara Yıldırım Beyazıt University. Then I was working for the last 8 years in the Council of Higher Education, and then moved to Washington, D.C. as education counselor as well. So we made lots of projects in higher education about combining basic sciences and clinical sciences. So for the multidisciplinary studies, interdisciplinary studies, and transdisciplinary studies, we have been working on trying to gather people together for the same aim, for the same aim actually, because there are hundreds of topics, they have priorities, and we need to work on them together. That's why we are giving much importance about on the transdisciplinary studies. So today we will talk about the transdisciplinary studies and the translational studies together. So we will start with the descriptions first, then I will give some examples for the multidisciplinary studies, transdisciplinary studies, and then we will talk about translational studies as well. Starting with the descriptions, we all know that transdisciplinary studies involves 2 or more academic, scientific, or artistic disciplines. And actually it's defined as research efforts conducted by investigators from different disciplines working jointly to create new conceptual, theoretical, methodological, and translational innovations that integrate and move beyond discipline-specific approach to address a common problem. So we have a common problem, and then we are working together for basic sciences and clinical sciences, more than 2 scientific discipline together, and we are using the same speed, the same methods, and we are working together. So for interdisciplinary studies or multidisciplinary studies, the differences for the multidisciplinary studies, you just join the team with your discipline and with your approach. But here you have a common problem and unmet needs maybe, and then you're working together for the same aim. Let's say for the environmental science and finding science for the climate change, etc. So you have to work with social, with scientists from social sciences, from psychology, and also from economics and from chemistry, etc. So you have the same goal, and then you are working together for the same aim, and you're not using your discipline's approach, but you're creating a new approach together with other scientists. This is transdisciplinary scientists. As you all know that there are many engineers working in the health sciences anymore. They are using transdisciplinary methods to work with health scientists together. Otherwise, they cannot keep moving together in the same path with them. So the medical research that is concerned with facilitating the practical application of scientific discoveries to the development and implementation of new ways to prevent, diagnose, and treat diseases, translational studies. As we all know, from the preclinical studies to clinical studies, we have bench to bedside studies called translational studies. It's very important, and the system and the methods to make translational approach successful is growing every day. So it's a new term actually. For the last 5 to 10 years, we are using translational studies more and more, but how we can build it in our ecosystem differs from country to country, hospital to hospital, research center to research center. It's not easy actually to make translational studies together. So we are making some postgraduate studies on translational studies, because you cannot just put everybody together and tell them that work together. But from preclinical studies to clinical studies, you have to build a common environment for them for translational studies. The research aimed at translating results in basic research into results that directly benefit humans is another description of translational studies. Usually we use it for biotechnology in the purpose of biotechnology. As I say, there are more and more studies every day to improve our translational approach in the scientific era. Maybe you know about the National Institute of Health. They're working there, so there are several institutions working on different scientific projects. One of them are National Center for Advancing Translational Sciences. I offer you to just check this website for your further studies to understand translational studies, and maybe you can join one or more of them, and you can have some ideas looking at these programs and initiatives at first. So for the translational studies, it's sometimes very hard to build translational centers in a community, but there are some successful examples in Turkey as well. I will mention that later. So as you see here, it's like 3D tissue bioprinting program. They are usually the urgent and emerging problem. They are trying to address the emerging problems and try to address new solutions for them. So 3D tissue bioprinting program, specialized platform for initiative research exploration, antiviral program for pandemics. Let's say it's a very, famous for now. Assay development and screening technology, etc. These are the examples for translational research. So the translational science aims to accelerate the process of turning biomedical research discoveries into real-world applications that improve people's health, such as diagnostic, treatments, and cures. Maybe you can say that all of scientific research, basic research, do some benefit to human being, but not always, because our findings, I'm also a clinical scientist, but I have my laboratory side as well as a clinical microbiologist. And as we all know that not all of our research sciences come into real life as benefit of human being. But for the translational sciences, you're working all together to, to go the pathway together with the clinicians. And then from preclinical studies to clinical studies, you work all together, and you know that there is work and the study goes on. So you're not expecting somebody to discover your study all of a sudden, but it's you have an aim at first, you're in the start line together, and then all other steps come one by one within a program to be successful for that unmet needs and for the same common aim. And usually the translational science helps people to bring more treatments to all people more quickly. This is what we call translational studies. So it's more quickly, and it has an unmet needs and a common goal, and people from different disciplines work together in that area. So it has scientific principles and operational principles. There are some says that there are 5 steps in translational studies, from preclinical studies to clinical phase studies and then clinical studies, but there are also scientific principles and operational principles. So the scientific principles of it is the focus on factors directly related to the selection of the research question. You have to ask right questions to start such kind of research at first, and then research approach, and then research methods together. So prioritizing initiatives that address unmet needs, producing cross-cutting solutions for common and persistent challenges. I think it's the most hard one, cross-cutting solutions, together producing cross-cutting solutions. So you're sitting together, working together, and make quick solutions for a reasonable research question, and emphasizing creativity and innovation, and of course, leverage cross-disciplinary team science. These are the scientific principles of translational research. And for operational principles, they usually focus on how team functioning, organizational environment, and the culture of science influence the research. Operational principles facilitate the science, actually. So enhancing the efficiency and speed of translational research, utilizing boundary crossing partnerships, using bold and rigorous research approach are the operational principles. So I want to tell you a memory of me. I was working in I was in the microbiology rotation in my hospital. It was like 20 years before, actually. So every day there was somebody else. We were checking for the culture results together. And there were some people from biology, and there were some microbiologists with MD degree. So those who ever has a medical degree, they were looking at the plates as a patient. So if there were like small colonies and they were just not saying, okay, wait another day for these colonies to go further to identify the bacteria. Instead of that, they were just trying to reach the clinic and ask about the patient's condition and try to get quick results for that patient, because they knew that the results are very important to make the treatment for that patient, give the appropriate treatment for that patient. But for the other day, I was with a biologist. We were checking, actually, she was very good at clinical microbiology. The techniques, she knew everything, really. She was, I think, more successful than the MD ones. But whenever she was looking at the plates, she was seeing the bacteria. She was seeing the plates, not the patient. And once she was saying that, okay, let's wait another day. And I said, oh, I know that patient, this is from my clinic, and it's very important to know the results. Can we just check it today as well? And she said, okay, whatever. And the other day, she was just checking the CSF results. And she said that, okay, wait another day to see the bacteria grow. And there were little colonies then. And I was just, I thought that if she would spend some time in the clinical world, maybe she will feel that these results are very, very important for that patient. For like 10 years later, in another hospital, I was getting the CRP levels. And at night, one of the ICU patient CRP levels was not appropriate, and we were trying to change the treatment. And I called the professor of the microbiology and I asked him that if the CRP results are working properly or not, because it doesn't seem okay to me. And he said to me, although he was an MD, but for years he was working in the laboratory, not going into clinic anymore. And he told me that, oh, we had a problem with the CRP test, but I didn't know that you were checking it so importantly. So you give importance to CRP levels. Of course, I'm giving importance to CRP levels, but he was so far away from the clinic for so long years. He was not aware that they were very important for us. It's like this. So working together working together makes you see other people's aim and your speed usually. So you see each other actually. For the translational studies, it's of course more than that, but for the transdisciplinary studies, we have to build on the hospitals as well. That's why we are taking care of this headings very much. So you can find more and more translational studies system within the NIH articles able, because building a translational research center is not that easy. Of course, it also it's about money as well. building a research center is not possible for each hospital, but for making transdisciplinary studies possible everywhere. So I want to give examples to work together for the same aim. For translational studies, of course, it's about the center's decision maybe. Maybe we can involve in those studies as well, but not each of you have this opportunity, even not me, I know, but for transdisciplinary studies, you can do it wherever you work. So let's say for the examples for presenting the studies, your work. If you ever go to New England Journal of Medicine's website, you see a very nice quality paper. Even the design of it needs some graphics. And, you know, we are making original articles. We used to just sit and read them in the past. But nowadays, they are building really good graphics, infographic videos, quick take videos, take-home messages, because not everybody has the same time to read all the papers anymore. So those researchers who make the phase studies, the researchers, you cannot expect them to make the videos and infographics and etc. But you can ask them what is the quick text of this article, because not every people reads 21 pages of research anymore. So we have to show our results, present our results to other researchers. So for their benefit, they have to know our results. So they are building new methods, infographic sheets anymore to show their results, which needs actually many people work together. It is not just making research, but also presenting your results to other people, because it's very important for social life, for your papers to be read by others properly. And whenever you give the message, they can take the message with the help of graphics, with the help of socialists, etc. And in Turkish Journal of Medical Sciences, we prepare a COVID special issue. We asked from our authors to make graphics, and they were surprised because they never used visual stuff in their research papers, in their review papers. And we forced them, actually. We said them every our review article should have at least one visual stuff to show people, and they're welcomed by others and used in the presentations. This belongs to me, and for preparing this visual graphic for my paper, I had to work with a professional person, and he had to read like 3 or 4 sepsis articles before drawing this to me, because he had to understand what I'm talking about. And then he drew something that I didn't like, and then we made it all together, and we worked together for this to make people read our research and understand sepsis more, because nowadays the youth and the new researchers doesn't have time to read hundreds of pages. So you have to give them the clue, what are they talking about? This is another example for presenting a review. It was about the first months of the COVID, and they were very welcomed and used in the presentations of our scientific community. And coming to health and technology, let's say there are also examples for working together with other disciplines in health and technology. As you all know that in COVID times, every pandemic brings a lot of solutions to daily life, right? And the COVID brings us the telemedicine and telecritical medicine as well. So they built a telecritical care medicine service, and it was actually, the activity was triggered by bedside stuff, algorithmic trigger software, etc. But they work with engineers, they understand each other, and then they made great job on it. And they made some respiratory therapy to patients by telecritical medicine working together. So we don't know what kind of other disciplines can to make our job easier. Another example from health and technology is the engineers, the electrical engineers show up with this article. It's really interesting. The biopsy-free in vivo virtual histology of skin using deep learning. This is a great study, actually. You can take a look at it. So I cannot even imagine about an biopsy-free virtual histology, but they are doing this anymore. So it's an example for transdisciplinary studies. It's very common in America for engineers to work in health sciences together with them. And the MD PhD programs, they also help a lot about building a common environment, common working environment for the basic sciences and health sciences together. So in Harvard, they have this Harvard MIT program in health sciences and technology. It's very nice that they gave the student, it's a bachelor program actually, and then they got their PhD degree as well. They have the basic sciences first, and then advanced clinical science experiences as well. And they have some science classes. And at the end of the course, they have MD degree from Harvard Medical School and PhD degree in medical engineering and medical physics from MIT or Harvard University. It's, as I said before, it's very common. The productivity is very important in American universities. And if there are some students eligible for MD, PhD programs, they build really good researchers. They raise really good researchers. They're not very crowded, but still they gave this opportunity. And they also have it in engineering and applied sciences. And from the bachelor degree time, these students have the opportunity to grow up, to have a mindset as a researcher, knowing basic sciences and clinical sciences together. There are some disciplines, actually, they're already working as a multidisciplinary team, like geriatrics, let's say. They're already, it's very common for geriatrics to work with other clinical staff together, but let's say for internal medicine, maybe it is less, but they're trying to grow up. For infectious diseases and clinical medicine, you see that they're trying to grow these links more and more every day. And they say it's not just a single individual in a single lab or single office. It's a group of people who are focused on a large challenge for interdisciplinary research. And they are more successful than those researchers who are done by just one group, one discipline. But some of the big challenges that they face, both social and scientific, are just not solvable by people sitting in their single discipline silos. Bringing those disciplines together in the long term is what provides big, big breakthroughs. Even drinking coffee together with other disciplines can show you some results that you didn't see before, actually. Okay. And teamwork within the hospitals, that we have to make it to also, because, you know, in the past, actually, every team working as separately, but nowadays we are trying to improve teamwork within the hospitals, because interdisciplinary healthcare education is more important than before. It's about the productivity, it's about the patient's sake, it's about, you know, every discipline has so much details anymore, so much focusing on their discipline, they cannot see other solutions, they cannot be aware of other solutions. So teamwork is more important nowadays, because there are many treatment opportunities and you cannot just solve it with the consultation reports. So there are many reports on working with interdisciplinary teams, their benefits, etc. This is a sheet from Oxford. So I was in Oxford once in bone and joint infection unit, and this was the program I have that day, because I had to work with my professor together, and she was in the microbiology department, in the ID ward, in the bone infection ward, and in another pediatric hospital in another day. Every day she was going to somewhere else. It was a big project in Oxford, actually. One professor was not working every day in the same clinic. So in my clinic in Turkey, every morning we are making together the inpatient work around together with my team. But it was surprising for me that in Oxford, a professor was working together in 4 hospitals, but with the radiology department, with the orthopedics, they were seeing together. They had outpatient clinic together with orthopedics and with the radiologists. So they were working together and they were wielding common sense and common solutions. They were speaking together. It was not just going and consulting someone. It was a very good example, actually. So the interdisciplinary research will shape the healthcare of the future, hopefully. And there, as I stated before, there are already some disciplines, they work more interdisciplinarily, like geriatrics and general biology, but some of them like economics or chemistry, they seem less interdisciplinary. So they have to build some projects to work together more. You will see many diagrams like this to solve common problems and gather people together, actually. It's a kind of system engineering to make people work together, because as we all experience that, not all clinics are open to other disciplines. At least they want to be boss, right? If you go there and say something about the culture results, they can say that no, we are dealing with this, and they can accept just their solutions. It's not like that. So you have to build a common sense together, and you can see many kind of system engineering approach for building interdisciplinary care within the hospitals. You have to be involved with the clinical staff as basic sciences researchers to see that if you're working for a good purpose or not, if you're working in a good subject or not, or at least whatever is in need, you can see working together with them. So communication is very important. I like this article very much because it shows about water-related infectious diseases and different disciplinary approach for it. It was surprising for me to, when I read this article, I was aware that, oh my God, we are giving the same results to all communities, all patients actually, but we have to think about the ecology, the anthropology as well, because each community has different features. Because, you know, once I was listening a sepsis speech in a European Congress, and the guy said that he was coming from South Africa, and he said that if I obey the sepsis guidelines, I will lose my patients because I don't have that much facility within my ICUs. And if I give them so much infusion, I cannot make dialysis for all of them, and I will lose them. So this is an this is an anthropologic approach, actually. So as I say, the article was on water-related infectious diseases, and in southern Nepal, they'll actually they couldn't boil the water properly, and in Sri Lanka, in Tanzania as well, and they feel very under stress because they cannot make it properly, and they cannot afford the fuel to boil the water. So we had to go there with other solutions. These were the anthropologic approach, actually. For the same problem, we have different approach in this article. Maybe you can check it out. Yeah, it was about this. And women, there were some women really, they felt under stress because they couldn't make the offers they're faced with. There's another article about this as well. So whenever we are giving some preparing treatment guidelines, etc., we have to think about the social sciences, the basic and clinical sciences have to work together, of course, and in which part of them we are using technology. Nowadays, to be successful, all disciplines have to work together. They have to find a way to work together. These are examples from Gambia. When I was there, before I was going there, I was asked to prepare an infectious disease course in Gambia. And we were preparing a course about hospital infections. But whenever I went there, I was totally lost because whatever I say as a course to those patients, those doctors were meaningless because they have other conditions than Turkey, and we had to find other solutions for them. So the communities are different, the hospitals are different, and for working together with other disciplines, with other clinics, you have to think about your possibilities and your clinical features, your research environment, etc. This is the reality of daily life that academicians sometimes skip, actually. So we usually give a guideline to our students, we give a guideline to researchers to obey, and then we wait them to make this properly. But all of you have different facilities, different research opportunities, and you have to create your own environment yourselves together with the other disciplines. The productivity is also important, that building transdisciplinary approach is not that easy because the population is so different. The number of medical schools, the number of the workforce, and the burden of disease are so different. You cannot just take one guideline and just make it into yours, because if there's just one, let's say, one clinician from ID clinic, let's say, you cannot just take him to research all alone and wait for them to not make outpatient work, etc. So you have to think about all of the guidelines for yourself too. In pandemic days, we see how important to work with others, because it was the first time, I think, in the American Journal of Medicine, they had the social determinants of health as well. Because we see, I'm sure that your countries have the same experience, that there were many specialists and physicians, ID physicians on TVs. They were talking about PCR, they were talking about vaccines, they were talking about cleaning hands, using masks, etc. But they don't have the sociology approach, anthropologic approach. So they were not recognizing what kind of sentences lead the population to have the so the consequences were not planned beforehand. So we were speaking on the TVs as physicians, but we couldn't imagine the population's reactions to them. So we were thinking that we will say the people use a mask, and then they will use a mask. But there were many stories against masks, and there were communities they were suspecting from the physicians, even though they were well educated as well. They were not just not undereducated people. Well-educated people had some concerns for vaccination programs, using a mask, etc. Even 100 years before, it was the same. And 100 years later, in COVID times, we were shocked that people were against vaccinations, against masks. And because of some scientists speaking on TVs, the populations grow bigger and bigger because they didn't think about the social consequences of their words. So we were not that successful, actually, and talking about the realities on TV, because this was something else. We were ID physicians. We were not leading communities with anthropologic approach. So in healthcare and health professions, giving healthcare education and building research ecosystem, building a research mindset is taken like for 100 years. It's changing and changing. There are 4 big changes in medical education. And once it was like instructional and the scientific curriculum for each discipline were separated. Nowadays, they are trying to make it together as well. But there are some systems, there are some guidelines, there are some methods for it. And we have to learn that methods to build a transdisciplinary approach ecosystem in our hospitals as well. So I just give an offer to you that you can check those examples first before building a transdisciplinary approach within your clinic, within your research center, or within your laboratory. In Turkey, we made some good achievements for the last years about the basic sciences, work together with the others. And there were some common needs, priority areas like molecular oncology, drug studies, vaccine studies. And we were getting people for the PhD degrees for those researchers from engineering, from health sciences, from basic sciences, working together to build a common ecosystem, research ecosystem. This was for 10 years before. We were making multidisciplinary team in my university. And after that, these students have a common approach for the multidisciplinary studies. It was very useful, actually. There are some examples from Turkey, let's say from Koç University and Bursa Uludağ University. They have translational medicine and they have also MD, PhD programs in some centers. These are the translational centers in Turkey. Eskişehir has it, Bursa has it, and İzmir 9 Eylül University has this approach. The last one is to build a mindset. As I said before, the MD, PhD programs are very important to create a common approach, a common transdisciplinary study mindset to the medical students. So these MD PhD programs allow this. So for the first years, when they are getting basic sciences, they just cut their medical education and then they go to laboratory work, they make researchers, and then they come back for clinical clerkships. It took 8 years to get MD PhD degree. It's a really hard program, but still many good researchers are raised from these kind of programs. So for transdisciplinary studies, we have to build in our laboratories, in our hospitals to be successful in healthcare and researchers. So for the daily routine patient care, for outpatient and inpatient care, and for making digital transformation for finding new solutions, we can have this approach. For new discoveries, of course, translational studies are very important from bench to bedside. And the clinical researchers, of course, and for building new diagnostic tools, we need this approach as well. So thank you very much for listening to me. I wish I can see your faces directly, but these were my presentations. I hope you will have opportunities to work with other disciplines properly. Thank you.